Ever wondered how surgeons access the brain to treat conditions like tumors, brain injuries, or aneurysms? The answer lies in an intriguing procedure known as a craniotomy. This sophisticated surgical technique involves temporarily removing a bone flap from the skull, essentially creating a window to the brain. The craniotomy, not unlike a keyhole into the intricate workings of the human mind, has been instrumental in advancing our understanding and treatment of neurological conditions. The process, while complex, is a testament to the remarkable capabilities of modern medicine, often performed while the patient is awake, allowing surgeons to monitor brain function in real time. Craniotomies are crucial in the treatment of a range of conditions. Brain tumors, for instance, can often be directly accessed and removed through this procedure. Similarly, in the event of traumatic brain injuries, a craniotomy can be performed to alleviate pressure within the skull. It's also used in the treatment of aneurysms and arteriovenous malformations, conditions that involve abnormal blood vessels in the brain. But the utility of craniotomies doesn't end there. They're also used in the implantation of deep brain stimulators for conditions like Parkinson's disease. This is where the precision of the procedure really shines, as surgeons are able to implant these devices with millimeter accuracy. The intrigue of craniotomies goes beyond the procedure itself. It's a reflection of the incredible strides we've made in understanding the brain, the most complex organ in the human body. It's a testament to the skill and precision of neurosurgeons, who navigate this intricate landscape with utmost care and expertise. Craniotomies, like many aspects of medicine, are a blend of art and science. Each step, from the initial incision to the reattachment of the bone flap, is performed with a delicate balance of technical skill and artistic finesse. It's a procedure that truly embodies the awe-inspiring capabilities of the human mind, both as the object of treatment and as the force behind its execution. Now let's delve further and break down the process of a craniotomy. A craniotomy may seem like a complex procedure, but it can be broken down into easy-to-understand steps. Let's start with the preoperative preparations. This is a crucial stage as it sets the groundwork for the procedure. It involves careful evaluation of the patient's medical history, neurological status, and imaging studies. The patient's overall health condition, allergies, and potential risks are all taken into consideration. Then the surgical team meticulously plans the procedure, determining the best approach and technique. Next, we move on to the creation of the bone flap. This step involves making an incision in the scalp and using a special surgical saw to remove a piece of the skull, called a bone flap. This is done with utmost precision to avoid any damage to the underlying brain tissue. The bone flap serves as a window to the brain, allowing the surgeon access to the area that needs attention. After the bone flap has been created, we dive into the heart of the surgery, the surgical procedure itself. This can vary widely, depending on the condition being treated. It could involve removing a tumor, draining a brain abscess, or relieving pressure on the brain. The surgeon uses a range of specialized instruments to carry out the procedure, always mindful of the delicate structures they're working with. Once the required surgical intervention has been completed, we come to the replacement of the bone flap. The bone flap that was initially removed is now carefully replaced back onto the skull. It's secured in place using tiny plates and screws that are designed to be compatible with the body. Finally, the scalp is stitched back together, and a dressing is applied to protect the surgical site. The patient is then taken to the recovery room, where their vital signs and neurological status are closely monitored. But that's not the end of it. Post-operative care is a critical component of the craniotomy process. This includes pain management, monitoring for complications, and supporting the patient's recovery. Rehabilitation services, such as physical and occupational therapy, may be needed to help the patient regain strength and functionality. Throughout this entire process, the surgical team works like a well-oiled machine, each member playing a key role. The neurosurgeon is the conductor of this orchestra, guiding the team through the complex symphony of a craniotomy. The anesthesiologist ensures that the patient is comfortable and safe, carefully monitoring their vital signs, while the nurses provide essential support, assisting with the procedure and caring for the patient. It's important to note that while we've simplified the process here, a craniotomy is a major surgery that involves significant risks and complexities. Every step is carried out with meticulous care, taking into consideration the unique needs and circumstances of each patient. That's the craniotomy process in a nutshell. But what about the specific considerations during the procedure? A successful craniotomy begins with meticulous preparation. The journey to the operating theater is paved with critical steps, all designed to ensure the best possible outcome for the patient. Let's start with patient positioning. This is a fundamental part of the process, and it goes beyond mere comfort. The patient's position can influence various factors, including surgical accessibility, brain relaxation, and the management of venous outflow and arterial inflow. Depending on the location of the lesion, the patient may be placed in the supine, prone, lateral, or sitting position. Next, we have scalp incision planning. This step is not as simple as making a cut. It requires careful thought and planning to ensure optimal exposure of the surgical site while minimizing damage to the surrounding tissue. Surgeons often use anatomical landmarks and neuronavigation techniques to guide their incision and bone flap creation. Speaking of neuronavigation, this technology has revolutionized the way we approach craniotomies. Like a GPS for the brain, neuronavigation provides real-time three-dimensional guidance during surgery. It allows surgeons to navigate complex brain structures with precision, minimizing the risk of damage to critical areas. In addition to these steps, surgeons may also use advanced imaging techniques such as MRI or CT scans to visualize the brain's structure and plan their surgical approach. They may also use functional mapping techniques to identify and preserve areas of the brain responsible for vital functions like speech and movement. The planning stage is also the time to consider the use of adjuncts like cerebrospinal fluid drainage or brain relaxation techniques. These can help to create more space in the skull, making the surgery safer and easier to perform. And let's not forget the importance of a multidisciplinary team. Craniotomies require the expertise of not only neurosurgeons, but also anesthesiologists, radiologists, and nursing staff. Their collaboration is vital to ensuring a smooth and successful procedure. With these preparations, surgeons can ensure the best possible outcome. Preparing for a craniotomy is a complex process, but with careful planning and the right team, it is a process that can ensure the best possible results for the patient. Anesthesia plays a crucial role in ensuring the patient's comfort and safety during a craniotomy. When it comes to anesthesia during a craniotomy, there's a lot to consider. A primary concern is whether to use nitrous oxide or not. Nitrous oxide, often known as laughing gas, is a common anesthetic agent. However, it has a tendency to increase intracranial pressure, which can be problematic in craniotomies. Let's start by exploring the anesthetic plan without nitrous oxide. This approach often involves using a combination of drugs. These might include propofol, a sedative, and fentanyl, a powerful painkiller. This combination ensures the patient is both relaxed and free of pain during the procedure. The absence of nitrous oxide doesn't mean the absence of risks, though. All anesthetic drugs have potential side effects and risks, such as allergic reactions or interactions with other medications. So it's essential to have a thorough understanding of the patient's medical history before formulating an anesthetic plan. Now, let's flip the coin and look at the anesthetic plan with nitrous oxide. Despite the potential risk of increased intracranial pressure, nitrous oxide is still commonly used in craniotomies. The key to safely using nitrous oxide lies in careful monitoring and management. By keeping a close eye on the patient's vital signs and intracranial pressure, an anesthetist can adjust the nitrous oxide levels as needed to maintain a safe balance. Now let's talk about the neuro exam while intubated and immediately post-operation. This is a critical step in assessing the patient's neurological status and identifying any potential complications early. The exam typically includes checking the patient's pupils for size and reactivity, assessing their level of consciousness, and testing their motor and sensory functions. Another important aspect to discuss is the use of a multi-orifice catheter. This device is often used to monitor intracranial pressure during the operation and can provide valuable insights into the patient's condition. Lastly, let's touch on the topics of hyperventilation, mannitol, and hypertonic saline. These three tools can be used to manage intracranial pressure during the procedure. Hyperventilation can temporarily lower intracranial pressure, while mannitol, a diuretic, can decrease brain swelling. Hypertonic saline, on the other hand, can help draw fluid away from the brain to reduce pressure. In conclusion, the anesthetic considerations for a craniotomy are complex and multifaceted. From deciding on the use of nitrous oxide to conducting a neuro exam while the patient is intubated, each decision carries significant weight. Anesthesia is a vital part of the craniotomy process, but it's not the only factor that can influence the procedure's success. The ultimate goal is to ensure the patient's safety and comfort while optimizing the conditions for a successful craniotomy. Managing intracranial pressure is a delicate but crucial component of a craniotomy. When we talk about intracranial pressure, we're referring to the pressure within the brain's cranial vault. This pressure can fluctuate due to various factors, including brain swelling or bleeding, and maintaining a balanced pressure is essential to prevent any brain damage during a craniotomy. Let's delve into 3 key tools used in managing intracranial pressure: hyperventilation, mannitol, and hypertonic saline. Firstly, hyperventilation. This technique involves increasing the patient's ventilation beyond their metabolic needs. The logic behind this is simple. By causing the patient to breathe faster, the amount of carbon dioxide in their blood decreases. This reduction leads to a narrowing of the blood vessels in the brain, which in turn reduces the amount of blood in the brain and subsequently lowers the intracranial pressure. However, it's important to note that this is a temporary measure, as the body adjusts to the lower carbon dioxide levels after some time. Next, we have mannitol, a type of sugar alcohol that can decrease swelling in the brain. When administered, mannitol works to draw water out of the brain tissue and into the bloodstream, thus reducing the brain's volume and the intracranial pressure along with it. Mannitol is a powerful tool, but it needs to be used judiciously to avoid side effects like dehydration and electrolyte imbalances. Lastly, there's hypertonic saline, a solution that contains a higher concentration of salt than normal bodily fluids. Like mannitol, hypertonic saline works by drawing water out of the brain tissue and into the bloodstream. However, it also has the added benefit of improving blood flow to the brain and reducing inflammation. So, in a nutshell, hyperventilation, mannitol, and hypertonic saline are the 3 pillars of intracranial pressure management during a craniotomy. With these techniques, doctors can ensure the brain remains safe and healthy throughout the procedure. Once the surgical procedure is complete, the final step of a craniotomy is to replace the bone flap. This piece of skull that was initially removed to allow access to the brain is now ready to be put back in its rightful place. This isn't a haphazard process, but rather a carefully orchestrated procedure that ensures the bone flap is secured properly, and the brain is well protected once more. The bone flap is reattached using small plates and screws that are made of a special material that doesn't interfere with subsequent imaging studies. This ensures that any follow-up scans will provide clear and accurate images of the brain. Now let's talk about the multi-orifice catheter. This is a vital tool used in the final stages of a craniotomy. It's inserted into the brain to help manage intracranial pressure and to drain any excess fluid that might be present post-surgery. The catheter is placed through one of the burr holes made during the craniotomy. It's guided into the right position under the watchful eye of the surgeon using imaging technology. Once it's in place, it helps to keep the brain's environment stable, draining cerebrospinal fluid or blood that may accumulate and potentially increase pressure within the skull. Remember, managing intracranial pressure is a crucial part of the recovery process for the patient, as any increase in pressure could lead to serious complications. The multi-orifice catheter serves not only as a drainage tool but also as a means of delivering medications directly to the brain, if necessary. This could include drugs like mannitol, which helps reduce swelling, or hypertonic saline, a solution used to draw excess fluid out of the brain tissue. So, wrapping up a craniotomy is not just about closing up the skull. It's about setting the stage for a successful recovery, minimizing potential complications, and ensuring that the brain is well protected and well managed post-surgery. And that's a wrap on the craniotomy process. So, what have we learned about craniotomies? Craniotomies, as we've discovered, are intricate procedures that require careful planning and execution. We've learned about the step-by-step process from the initial setup to the final sutures. In particular, we've delved into the significance of anesthesia considerations in these operations. The choice between an anesthetic plan with or without nitrous oxide can significantly impact the procedure and the patient's recovery. We've also explored the importance of managing intracranial pressure. Techniques such as hyperventilation and the use of mannitol or hypertonic saline are crucial in maintaining optimal brain conditions during the surgery. Finally, we've touched on the immediate post-op neuro exam while intubated, and the use of a multi-orifice catheter, underlining the meticulous attention to detail needed in a craniotomy. Remember, understanding the intricacies of a craniotomy can help us appreciate the incredible work our brain surgeons do to save lives every day.